must constantly look at things in a different way.
The Healthcare Education Transformation Podcast was created by two physical therapists out of the desire to learn more about the different educational roles in physical therapy and healthcare, and how healthcare education works by talking with educational leaders and people with different perspectives within physical therapy and across interdisciplinary lines on how education can be improved to disrupt the status quo of healthcare education. This is our journey, and thanks for listening. Are you a third-year physical therapy student that excels on tests when you have study guides, checklists, and deadlines? With all of the information available about how to prepare for the NPTE, it's easy to get disorganized and not feel prepared going into the big day. NPTE Prep Success is an online course that provides PT students easy-to-use study guides and step-by-step guidance through the NPTE preparation. To learn more, visit kylericeprep.com. Thank you again all for your continued support, and now for the show. All right. Hey, everybody. Welcome to another episode of the HET podcast. I am your host, Brandon Powen, and today I have an extremely talented and special guest to talk a little bit more about leadership as a core value for faculty and students within healthcare education. As today, I am very thrilled to welcome Dr. Nancy Reese. Now, first and foremost, before I kind of dive in and introduce Nancy, I want to give a huge shout out to our good friend Jim Hoyme for actually recommending Dr. Reese for coming onto the podcast. So Jim, thank you so much for all that you do, and thanks for the awesome recommendation. Now, a little bit more about Dr. Reese. She is currently a professor and chairperson of the University of Central Arkansas's DPT program. She has a master's degree in health administration, and she received her PhD in anatomy from the University of Arkansas for medical sciences. As a professor in the department, she teaches neuroscience and administration, as well as core courses in the PhD program. She is also the author of two textbooks, one of them being Muscle and Sensory Testing and Joint Range of Motion and Muscle Length Testing. She is the treasurer of ACAPT, which is also the American Council of Academic Physical Therapy, and she's also representative on the Education and Leadership Partnership. Her research interests include movement restoration following spinal cord injury, and her clinical specialty is adult and pediatric neurorehabilitation. And on a more recent note, she was recently named as a Catherine Worthington Fellow of the APTA, which is a tremendous accomplishment. So, Nancy, I know there's a lot more that you've done throughout your career despite this short bio, and so I'm sorry I'm not able to get into it all. But I'm always fascinated when we're talking with various educators and leaders on kind of how they've gotten to where they are, and especially hearing from numerous academics how everyone gets into academia a little bit differently, and their stories are interesting. So I've got to ask, before we kind of dive into the topic of leadership, would you mind kind of sharing a little bit more about how you got involved with education and leadership, so it's where it's gotten to where you are today?
Sure, that's a great question, Brandon, and it might be a long story, but we'll start. It started when I was in PT school, actually. So I went to physical therapy school at the University of Central Arkansas. And I tell people that I went to PT school in the dark ages because it was a long time ago. Jim Hoyme was actually in my class. He and I were classmates and good friends in PT school. We sat in the back of the room and were the students that make me cringe today because we talked and didn't pay attention. But when I was in PT school, it was a time that was kind of tumultuous for this particular program. They were going through a transition in leadership, and we actually had, over the time period when we were in school, which was about 19 months back then, again, this was the dark ages, we had 3 different program directors. So there was some conflict, there were some issues that came up during the program, and I just remember feeling like, I could do this better than they are. And you know how when you're a student, you think you can do anything. And I was a student who thought I could do anything. So I thought, I'm going to do this one of these days. I'm going to be a faculty member in this program. So when I got out of school, I went into practice with adult neuro, and then I went into different setting and did a lot of things, including pediatric rehab and inpatient, outpatient, variety of things. And I started on my master's degree. And when I was almost done with that, I got a letter from a faculty member, Joe Fennell, who was the original chair of the program at UCA. And he said, would you be willing to apply for a faculty position? And I was just absolutely thrilled. I was so excited. And so I did. I applied and I got the job. And I have, with the exception of a short stint in which I was doing an internship in health administration at Arkansas Children's Hospital, I was a faculty member here and have been. So that's kind of how I got into education. I knew it when I was in PT school that it's what I wanted to do. In terms of the leadership piece, that started probably between 12 and 15 years ago. I can't remember exactly. When we were having an alumni event here at the university, and I was teaching the administration class, and Jim came down for the alumni event, and he and I were talking in the hallway about leadership and about some things he was doing in his practice. And I thought, my students need to hear this. So I said, would you be willing to come down and talk to my students about leadership? He was working on his MBA, as I recall at the time, in ethical leadership. And so he was happy to do it. He came down and did, I think, about a 4-hour class or so, maybe a little longer with my students. And that was sort of the beginning of our collaboration together with leadership. It was rough at the beginning, and he will tell you the same thing, that it wasn't the greatest, but we've been working on it over all these years, and every year it gets a little better. And then he's started doing the same thing with some other PT programs, and we've expanded the leadership that we do here beyond what Jim does. And so that combination has really made our leadership program a lot more robust, a lot more helpful. And we keep looking for ways to do more, keep looking for ways to do better at this, because we could spend 3 years teaching students leadership and nothing else. So trying to balance that with the rest of the program is sort of our goal, but to really make that a strong component of our program.
I think it's really encouraging to see just what has been done between Jim and just so many other leaders like yourself to really influence more leadership integration in education. I know one small thing, we had Janet Besner on in the past to talk about ACAP's initiative on that as well. And that's just one example. But, I want to kind of take a little bit step back and go a little bit broad on this next question here, because if I could ask this next question, there's probably 15 different responses at least. So I guess the big question is, how do you define leadership? And what were some of the biggest transformational moments for you among your leadership development throughout your journey? Like, what were some of those big, aha moments that kind of really stood out to you that really changed how you were as a leader?
Great question. So I'm a John Maxwell fan, and I don't know if you know John Maxwell's work, but I have followed him for years. So he defines leadership as influence, and I really love that definition. He says leadership is influence, nothing more and nothing less. And I believe that. It's your ability to influence other people, which means that there is leadership in all of us. And the more you develop that leadership ability, the more you're going to have people who are influenced by you and who will follow you and join in on whatever initiatives or projects that you're trying to accomplish. So I like that definition because it's so simple and yet so complex at the same time. It's so encompassing of what a leader actually does. For me, my leadership journey started many years ago. And I think my first leadership training was really in my church when I did the Maxwell 21 Irrefutable Laws of Leadership. We did that program, and I was really struck by him. The other strong leadership influence for me was Stephen Covey, 7 Habits of Highly Effective People. And I had read that book many, many years ago. and I don't know if you've read Covey's book or not, but I find Covey so insightful, but really hard to understand sometimes. I have to read him multiple times to really kind of get it. So I had read it, and it was sitting on my shelf. And so I picked it up, and I thought, I really need to read this again. So the second read was much more enlightening than the first. And I think one of the points at which I had a real aha moment was reading Covey's chapter on both proactivity and his chapter on, I'm trying to remember which chapter it is, but he talks about basically a situation in which a person has a boss that they struggled with, that this person has complaints about their boss, how terrible their boss is, whatever. And Covey confronts him and says, basically, what's your part in this? It's your reaction. You can control your own reaction. And are you really helping this person? Are you adding to your boss? Or are you just basically degrading the person and trying to see your own interests and not serving the interests of your boss? And I had been in a similar situation in the past, and I had done just what this man had done. And I realized at that point that I had created the negative situation myself, that it was my responsibility, not the other person's, it was mine. And that was a huge aha moment for me, to just say, you know what, I'm not the victim here. I was the perpetrator. And that was a very humbling experience and a very eye-opening experience for me, and something I still struggle with in terms of thinking proactively and assuming positive intent all the time. I think that's really important. And it's something that Covey really spoke to, and I heard it, unfortunately, after the fact, but that made it really sink in for me, I think. Other leadership development, oh my gosh, it's been constant for me that I have learned so much from so many people. I work on ACAPT, on the board of ACAPT, and I work with such great leaders in that association. And so just seeing my colleagues and watching my colleagues and learning from them, just from their actions and conversations, that's been amazing. I have done a lot of self-study. I read a lot of books. I listen to leadership podcasts. I do a lot of learning that way. I got to go a couple of years ago to the Harvard Management Development Program, which is a 2-week program in the summer. And that was fantastic. One of the best experiences of my life. And I think partly because it's 2 weeks of being very selfish. And all you do is learn about leadership, and you get to be in a class with, 90 other people from all over the world and talk about things all day long, and then read about it at night. And you don't have to worry about anybody but yourself for 2 weeks. You're staying in a hotel in Cambridge, and it's kind of a self-indulgent sort of thing, but it was fantastic. It was, I still keep up with some of the folks from that experience, and it was just a really life-changing experience for me.
Yeah, I can only imagine. I've heard tremendous things about that event, and that's definitely on my list at some point in the future. Definitely not in the immediate future, but in the near future for sure. You've touched on one of the big ones here in regards to kind of a really defining moment, or as we call it, kind of I don't want to say mistake, but I'll say a learning experience, shall we say. Especially when you kind of had really made that aha moment, realizing that, maybe I need to examine my actions and what I'm doing and see how I'm contributing to this situation, rather than just, assuming or being more in a negative mindset or blaming the other person. And that's a really good example. I completely agree. That's a very solid lesson. Have there been any other kind of similar situations or learning experiences specifically like that have kind of also helped you propel forward?
Yes. So I think there was a situation once where there was a situation in which there was some conflict with a faculty member. And this was when I was not chair, but I was a fellow faculty member. And I knew this was going on. And I knew this person personally outside of work as well. I had a relationship with this person outside of work as well. And I became aware that there was a situation with another group of faculty. And I rationalized to myself that this was a problem between this faculty member and this other group, and that it didn't involve me. And so I did not need to get involved with it, when in fact I should have. I should have counseled this other faculty member. I should have gone to this person and talked to them about what was happening. But I didn't. And so I learned from that I have to care about other people beyond my level of comfort, in terms of, if something is uncomfortable, I have to put caring of that person first and deal with the discomfort. And if I need to confront, if I need to have a conversation, I need to have that conversation because of my level of concern and caring about that other person. So, because it did not turn out well for this person. And I take some responsibility for part of that, because I didn't have the conversation that I needed to have. So I think that was another thing. And I, it's easy. I tell my daughters, I have two daughters who are, one's in her 30s, the other's in her 20s. And I tell both of them, you learn from, the way you learn is from pain. It's from mistakes, and growth comes out of pain. And yet when you're going through it, it doesn't feel very good, right? But when you're asking me this question, everything I think about is the places where I really learned the lessons. Not all of them, but most of them are from painful experiences where I've messed up and I've made a mistake, and then I've grown. Or when I have grown from some situations, but they've been hard situations. So I may have handled them well, but it was always something I didn't really want to do, like, times that I've had to fire staff or other things like that. Those things you don't want to do. You don't want to have to do those things. They're difficult, hard things, but those are the things that teach you lessons.
I think that's an absolutely solid point. I mean, so much wisdom in that, because it holds so true. We learn so much more from our mistakes than we do from our successes. And not that we don't learn from successes, but I'll agree, at least anecdotally, it doesn't seem to have near the weight and carryover as a failure does. So I completely agree with that. I recognize, Nancy, that some people aren't aware of the Clifton Strength Finders. Would you mind kind of sharing a little bit about what specifically that is, and even sharing what are your top 5 Strength Finders?
Sure. So Clifton Strength Finders is a collection of 34 strengths that the Gallup Corporation put together based on surveys of thousands and thousands of people. They developed a questionnaire, and they used this questionnaire to delineate what your top strengths are. And their premise is that one gets so much more return from focusing on developing strengths than on developing weaknesses, that the percent return is so much greater if you really work on your strengths. Not that you shouldn't address certain weaknesses that are critical, but that you get a bigger bang for your buck by working on your strengths than you do than working on your weaknesses. So we use this survey with our students. And that's because the Strengths Finder, one of the great characteristics of it is that it doesn't say, here are your strengths and here are your weaknesses. It just says, here are your strengths. So it's not threatening. So when someone takes the Strengths Finder, there's not really anything scary about it. And sharing your results with someone else is not really scary, because it's just different. It's what are your strengths, but you're not revealing weaknesses to anyone. So we started using this with our students many years ago, I think in 2008, and we use it to help them be able to talk about themselves to other people, because every time you go on an interview, somebody asks you usually, what are your strengths? What are you going to bring to this job? So that gives them a venue to answer that. And we also use it for students to be able to get to know each other from the very beginning. So from day one, they talk about their strengths and they get to know each other's strengths. And we use strengths in the curriculum to put them into groups so that we have some people in each group that have responsibility type strengths so that we make sure that the work gets done. Some people who have communication strengths so that they're pulling the group together and so forth. And so we kind of balance out the groups that way. My top 5 strengths are strategic, relator, achiever, learner, and developer. So I think strategic is definitely my number one. I consider a situation and I can see sort of where we need to go, what needs to happen, how we need to get from here to there, different possibilities, different ways of doing things. So my mind automatically it immediately looks at a problem and starts saying, okay, here's what we need to do. And that's a great strength. It's also something that I have to temper because when you're in a group, you want to hear everybody's ideas and you don't want to blurt out your ideas in the beginning. So I really work on listening first and then trying to pull together all the different possibilities before going forward. But sometimes it gets me into trouble because sometimes I'm just like, this is what we need to do. Can you not see this? Right. And that's more in the family thing. I do that with, I've got things, already worked out in my head. And then somebody else might not be quite at that point yet. And then I kind of get a little impatient, but I like being a strategic thinker. I like being able to kind of solve problems. So, but those are my top 5. And we've really found StrengthsFinder to be a great tool. We here at the university have started a chairs leadership development retreat. We started it last year at my university I've been chair here for 15 years. And until I went to the Harvard thing, I had 4 hours of training to be a department chair. And there was not a training program for chairs or administrators here at this institution. So last year, the director of the Center for Teaching Excellence asked me to help her develop a leadership training retreat for chairs. And we did that. And we had them do StrengthsFinder. And several of them now have done it with their faculty. So we have a StrengthsFinder. I don't know what StrengthsFinder calls a StrengthsFinder coach. That's what it is. We have a StrengthsFinder coach in our student leadership department here on campus. So he did the training with the chairs, and so he started offering it just to faculty and staff across the institution. They could come in and do StrengthsFinder and learn about their strengths and all of that. So it's something that's sort of starting to be part of the culture here across the entire institution, but it's been part of the culture in this department for over 10 years. So I think it's a great tool.
Yeah, and I love that. And we'll dive a little bit more later on more specific ways of leadership integration into the programs. I think that's an avenue I definitely want to cover. And I think it's funny hearing your top 5 and realizing we share 3 of them. Because I'm a learner, achiever, relator, responsibility, and includer. And if I had to choose one that I'm probably the most, probably the top one, I would probably say, at least at this point in my life, it's probably more of a learner. Being a newer clinician and going through a lot of clinical development stuff, it's definitely my world right now. So I think that's a pretty accurate statement. And, Nancy, you'd mentioned, of course, a few good points earlier, of course, with integrating StrengthsFinders and stuff, and that retreat and a few other things within the program. But let's back up a little bit. Let's go before even getting into the physical therapy program there. How does the current PT application process for University of Central Arkansas, how do we screen and select for leadership potential? And how does this compare, contrast to maybe other application processes across the country?
I think it was at a Graham session when it was in Memphis, and I can't remember what year that was, that we had a conversation about Strengths Finder and PT students. And at that point, we had some data, and PT students look pretty similar on Strengths Finder. And so we had some data about, kind of the top strengths that you see in a PT student on Strengths Finder across the country, across the programs that Jim was working with. And from that, we had in the next year a conversation, are we admitting the right students? And so that's a conversation that's been going on for a while. Are we relying too much on GPA and not enough on other aspects? At the University of Central Arkansas, we changed our admissions process a few years ago from one in which we looked at strictly GPA, cumulative GPA, science GPA, GRE scores, and then did small group interviews, and it was like a pass-fail thing, and it took a lot to fail an interview. And so basically a lot of reliability on the numbers and not much reliability on the interview process. We changed that to have a structured interview process in which the students interview with very specific questions, the interviews scored by the interview group, and then the students are also interviewed in larger groups as well. And that process has allowed us to not only have more diversity in our class, but has allowed us to really find some students who have some leadership history. So we look also at their leadership, what they've done in leadership as they've gone through their undergraduate degree program. Now, the literature will tell you that a single interview is worthless for jobs, for anything. One single interview it tells you nothing. It has no validity whatsoever. However, going strictly by the numbers is also problematic. So we are still evolving in terms of our interview admissions process and looking at other ways to do this. So we are constantly evaluating, has this worked well? What do we need to change? We've looked multiple times at the multiple mini interview that started in Canada and has been used in a lot of medical schools there. It's basically a situational interview, and the student goes through multiple stages of multiple rooms in which they're confronted with some challenge that they have to go through, solve, whatever. I know that there are a couple of PT programs that are doing that one. And so we're sort of waiting to see how it goes for them. There have been a lot of conversations about how we improve the interview process in order to make better decisions about people who are a good fit for physical therapy. I think for us, the soft skills are critical. The ability to communicate, the ability to present yourself with confidence, the ability to relate to people, those things are very important in our selection process. And those are the things that we really are looking for in a student besides their ability to make it through the program. So I think we've got a long way to go as a profession to figure out this problem. And there needs to be a lot more work about the other side of this. Are these methods that we're using changing the face of physical therapy and what we really need in the profession? So we need to get to that. What are our measurements? What are our outcomes? And how are we going to measure that? So I think go back to answer your question about how our process is different. I think one way our process is different is that we do continue to interview, whether that's good or not. You'll hear both sides of that. There are programs that don't interview, and there are programs that do, and we're one of the ones that do. I think we have a structured interview process, and we have borrowed our process from some of our fellow programs. And I think, you said you talked to Janet Besner about what ACAPT is doing, and she's at Texas State, and I think Texas State has a lovely interview process where they allow students to tell their story. and they look at basically what a student has been through. And so I think they're kind of getting at that whole grit piece of, how have you persevered in the face of adversity? So there are some things that we can learn from our colleagues. And I think that's one of the reasons it's really important to be involved nationally with your colleagues so that you can learn from them and you can gain information and you can make your own place a lot better. So.
No, absolutely. I completely agree. And it's been interesting kind of hearing this topic talked about because, like you said, I mean, it certainly seems like we've come a ways since then, but we still have a ways to go to figure out what's the optimal way. And we're still learning about that. And, it's funny. You had actually mentioned this in the past, and I've heard this from other educators as well, is that, knowing that developing student skills to succeed in life and actually be change agents is really a daunting task. Teaching certain skills like clinical skills and certain things isn't usually the challenging part that most educators have really found. So what have you found tends to work best at effectively addressing really fostering proper leadership and really fostering students to be change agents to change our profession forward? What have you found that works best to ultimately address that in entry-level education? I know you mentioned the retreat, you mentioned strength finders. Are there any other things that you've kind of found or heard of that can also kind of help push this avenue forward?
Oh, what a great question. And I don't know if I have the answer for you on that. In our program, and what I've seen really is that we try to first get students to be able to lead themselves. So we do, the students before they come read the 7 Habits, Stephen Covey's book, 7 Habits of Highly Effective People. And a PT student will do anything before they walk through your door the first time because they're so excited that they got in your program, and you could tell them to go jump off a cliff and half of them would. And I don't mean that in any kind of a derogatory way. I just mean that this is the time in which you can really do some things before they come in and start taking gross anatomy and get totally overwhelmed. This is the opportunity point, is before they show up. So we have them read the 7 Habits and do some pre-work on that before they actually get here on the first day. And then we use that. We spend 3 weeks during the first semester covering the different habits of Covey with the students. And the intent is to help them develop as a person, because until you develop yourself, until you start doing that self-work, you can't influence anybody else in a positive way. So that's our focus. It's really self-leadership. And then I think what you said about developing students to be leaders, to be effective, is kind of a misnomer in that they have to develop themselves. We can't do that work for them. And it's hard work and it's internal work. We can help them practice. So we can help them, and we do help them practice communication. We bring somebody in from the communications department who talks about communication. And then later in the time that they're here, we do difficult conversations with them. Some of that training. We have them, practice just talking to a patient, how to, just doing some role play and that sort of thing. I think that's what those are some things that we can give them during the program. We do lots and lots of things where they have to speak publicly, so they get that practice. But the internal practice has to be theirs. Our job is to make them understand how important that internal practice is, how important it is to gain that emotional control. One of the things I'm really excited about is, and I'll just mention it here, and we'll probably hit on it a little bit later, is a study that we're starting with 4 other institutions across the U.S., 4 other DPT programs, on emotional intelligence of DPT students. And we'll be measuring that from the time they come in until the time they leave. And we'll be able to use that as a measure, our program will, of, are we making an impact on their emotional intelligence over this 3-year period? in the program. And we'll be able to look at that across all these institutions to see what changes there are in emotional intelligence across their 3 years in the DPT program, and whether, the differences that each of these programs have in their level of leadership training or soft skills training, whatever you want to call it, whether there's a difference then in the change from day one to the end. So, and there's some other aims of this research that I won't get into, but that for me, that's really exciting. It's just to be able to see what kind of change we are making if we are making a change.
No, I love that. And I cannot wait to read that study once you guys collect all that data and put that out there. And I'm just kind of curious because, I'm not a researcher really myself. How are you guys planning on actually measuring like emotional intelligence? Like what's the outcome measure, or how we actually measure that?
Mm-hmm. That's a great question. So this study was started by Janet Vesner and Sean Soper, so Texas State and Virginia Commonwealth University. And we're using a tool called the Drake P3, which is an emotional intelligence scale that has been used in various industries, and it has been validated and has had some reliability testing. It's been found to be reliable, and so this is the tool that we're going to use to measure that with the students. So they'll take that in the first year, and then they'll take it again at the end.
Well, yeah, and I think that's really interesting to kind of see that we're looking more internally in our own profession. But I'm curious, Nancy, is there any evidence that looks at kind of specific leadership, emotional intelligence when it comes to maybe other healthcare providers in terms of their education? Like, have any other healthcare professions done research similarly to this? And if so, what have we learned from that?
So, yeah, that's a great question. And I know that other professions have done some of this work. I know that because I haven't read a lot of the literature on this, but I have looked at some of the, done some searches just to see what's out there. And I know that there are other professions that have looked at emotional intelligence. They've looked at grit to sort of see, what that looks like in their program, or what that looks like in their profession. So I think a lot of folks are beginning work on this in this area. I don't know, like I said, I've not looked at the scope of literature in emotional intelligence at this point to really see where it has been fleshed out. I would say usually nursing is on top of a lot of this. Medicine sometimes. I know that medicine is looking at, they've developed these entrustable professional activities. So they have developed these things that they believe physicians should be able to do by the time they graduate. And many of those are the soft skill side types of activities. So they've done some work on that. Not sure, like I said, I'm not wholly up on that particular area at this point. Mostly I've just been trying to manage the details of getting this study started in terms of getting the IRB, submitted and all of that sort of thing. So Janet and Sean are the masterminds behind this project. So I know that they are both very, very up on that literature.
Talking more broadly about leadership, across DPT curricula across the country, do you feel that overall we're doing an adequate job of really enforcing leadership and emotional intelligence? And why or why not? And is leadership sufficiently represented on the CAPTE requirements?
So I think the extent to which leadership is addressed in DPT programs is variable across programs. It is not a CAPTE criterion. There are some elements of practice management in the CAPTE criteria. So there are elements of communication and other components of leadership in the CAPTE criteria. So we expect students to be able to communicate effectively with peers and patients and family members and all sorts of different individuals. We expect students to be able to communicate both orally and in writing and other ways. We expect students to be able to do components of practice management like public relations and marketing and financial management and those kinds of things. We expect students to exhibit professional behaviors. That's part of CAPTE, so that they are ethical and conform to any kinds of regulations and other kinds of things, and they act in a legal way, and those are all parts of leadership in a sense. But the specific terminology of leadership is not part of the CAPTE criteria. So programs talk about leadership in different ways. Some of them have more of an emphasis on it. Some of them have less of an emphasis on it. Some programs don't really talk about leadership at all because it's not in that required minimum set. I think I would love to see leadership be central to all programs. Like you said earlier, programs struggle less with the clinical skills than they do with the soft skills. For me, you can teach anyone to do the clinical skills. It's not rocket science. It's not hard. It's the interpersonal skills that are so critical for physical therapy because of the time that we spend with patients, because of the fact that we are one of the few health professions that has that much time with a patient anymore. And the patient is starving for that personal interaction, that personal touch, that individual who will pay attention to them and their concerns and address those concerns. And I think that's huge for our profession. It's huge for all health professions, but it especially is huge for physical therapy because we spend more time with the patient than many other health professionals do. So our students need to be skilled with that. They need to have that mastered. They need that in their tool belt so that they can provide the patient what they need. If programs are not addressing those skills, then we're doing a disservice to this profession. We should not graduate students who lack those skills, but sometimes we do because they can do all the clinical skills. So getting at those non-clinical leadership, interpersonal skills is the responsibility of every program to make sure that the students have those before they graduate. We've used the professional behaviors a lot to sort of gauge that, and I think that's great. That gives us the interprofessional piece, the human touch piece. It gives us the communication skills. It gives us the ethical piece, all of that. By adding leadership, it helps our students to go one step further and start to become that change agent. Because if you go back to leadership as influence, then that's when you start to embark on that ability to help other people, influence other people, that they can make the decision to change. So helping students do that allows them to then influence their patients and influence society to become a healthier group, to go back to their former way of living, to go back to a more functional life, to go back to a better life. The PT can't make the patient change any more than anybody can make somebody else change, but they can influence that person toward change if they know how to be a leader. So to me, all PT programs need to be teaching students to be leaders because we are expecting our students to influence their patients to change. Even if that's all we're expecting, that's still leadership. So we need to help students do that. The reason I think many programs don't is because it is hard. It is hard to teach soft skills. It's hard to talk to someone about their need to be a better communicator, about their need to be a better listener. Those things seem very personal. It's easier to say, put your hands here, not there. To stand this way, not that way. Push here, don't push there. It's easier to teach those clinical skills. It's harder to correct what we see as part of someone's personality instead of seeing it as a skill that you learn just like you learn where to put your hands when you're doing manual therapy. If we can look at it that way, as just as a skill, and we're teaching students these skills, then we can talk to them about learning those things, and it feels a little easier, and it doesn't feel so intrusive, and it doesn't feel so personal. And so it doesn't feel like you're insulting them, you're helping them, you're just instructing them. Does that make sense?
Yeah, no, absolutely. Because it's kind of interesting going through and just hearing that point of view. It's funny. I went to a continuing education course a couple weekends ago, and one of the big things, of course, was it was like lumbar spine management. But of course, it's a very eclectic class, so it talks a lot about the subjective aspect, objective assessment, treatment, and then nutrition, lifestyle. So it covers a lot of stuff, and I love it. And one thing that the guy Jeff Moore, he said that really always kind of stood out to me, and he's like, a lot of times patients often don't need education on certain things; they need inspiration. And I thought that was just so true, because he's like, people generally speaking know how to be healthier. It's like they may not know the exact specifics, but he's like, generally speaking, people know they should probably exercise more, should probably sleep better, and should probably eat a little bit better too. That's usually not the issue. It's they need the inspiration. They need to see role models. They need to have someone there who inspires them to do that. And that just really stuck out to me, like really, really strongly. And this goes back to your point earlier, of course, influence. So I think, I mean, absolutely. I mean, I think that's absolutely clutch. And one thing that, that's really essential to, fostering development of any kind, whether that be clinical skills or leadership, emotional intelligence, is of course the faculty. Big piece.
Yeah.
So I know this could be a whole different podcast of itself, but if we could just touch on faculty a little bit, what are some examples of other important leadership qualities that faculty members should have, and how does your program select for specific leadership traits when hiring faculty? Because you had mentioned, of course, what you guys do for students. How is that similar and or different compared to faculty?
That's a great question. And it's a little tough in physical therapy education because there is a national shortage of faculty, as you probably know. So, and that's getting worse as more and more programs develop. We have more and more faculty openings, and fewer people in physical therapy who are going into PhD programs. And so the pipeline is not robust. And in addition to that, a lot of faculty are aging. So we have a lot of faculty who will be retiring, and not enough faculty to replace them. So we're getting pretty critical here in terms of faculty members. So sometimes it's hard. Some programs don't even have the option of selecting among a cadre of candidates for a faculty position. So, but optimally, if you're looking at faculty and you're looking for who could come in to replace, to fill an open position for us, and I think for any program, you really want someone who's a fit with your culture. So we want someone who fits with our culture, who fits with our core values, who is dedicated to doing the things that we're dedicated to doing here. So that's the first thing is, what's the fit look like? What is this person, do they buy in to what we're trying to do here at this institution? Do they have a passion for it? And the other thing that's really important to me is, does that person bring a perspective that is different than the perspective that we have here? Because we want to hear a variety of voices. We don't want everybody saying, coming in with the same mindset, because then you just perpetuate, what you've been doing, and there's not change. So you want someone who's got a different perspective, different experience, different ideas, someone who can bring in fresh air. That's another thing that I tend to look for in a new faculty member. And then, of course, I want somebody who's got energy and who's got some initiative and who can work I don't want to say autonomously, but who can work without direction. I'm not a micromanager, never have been. I probably err on the opposite side of that, in that I maybe assume that someone has more ability than they might have from the beginning. Maybe I don't give enough direction, but I like people to be able to contribute actively and feel empowered to do their work, and who want to be engaged in this whole process with the rest of us in terms of producing the best physical therapists that we can possibly produce. And so if they don't have a drive for excellence, then that's not going to be a good fit. So those are the kinds of things that we really look for when we're looking for new faculty members.
Gotcha. And, of course, Nancy, realizing how rather chaotic that working in a program can be with all the things going on, but also recognizing that, some programs want to focus on improving their focus on leadership and faculty to kind of contribute to positively influencing that culture. So, of course, that ultimately there's trickle down to students as well. Are there any specific activities, initiatives that your program does, or that you've heard other programs that do, that kind of continue to work on progressing faculty's own leadership within the confines of academia?
Sure. So we've done a variety of things over the years. I would love to be more consistent at this, and I will be the first to tell you that I have not been consistent. And I'm right now trying to learn that whole, the discipline of being consistent. That's what I'm working on at the moment. So the faculty have done Strengths Finder. Every new faculty member who comes in does the Strengths Finder. So we know the Strengths Finder of all our faculty and staff. The Strengths Finder results, we have a chart on that. We've talked about that at meetings, and has really been helpful in terms of learning the strengths of other people that we work with, so that we can interact with them more appropriately. I'll give you an example. I have a faculty member who's deliberative, one of her strengths, and so she needs information ahead of time in order to be able to not feel overwhelmed, because she needs to analyze it a little bit before she takes action. And I was giving her tasks at the last minute. And when I found out her strength, I looked at her and said, "I have been driving you crazy, haven't I?" And she said, So now I know not to do that anymore. And so I'm careful not to give last minute tasks unless it's totally unavoidable. So those things have helped. We've done the Covey book together as a faculty. And when we first started doing the Covey book with students, we would have Covey groups with the students, and different faculty would each take a group. And so that helps us to kind of reinforce some of that as well. We've done some John Maxwell training sessions with the faculty. We've had individuals come in to do difficult conversation training with the faculty. We did that last year in our retreat. So we've done a variety of things to really try to help faculty get leadership training within the department. As I said, I'd like to be more consistent with that. I'd like to, offer something on a consistent basis, because it takes, multiple exposures over time for people to really get these skills under their belt.
Oh, absolutely. And I'm sure just, that focused repetition and consistent practice is, another thing added in there too, for sure.
Yes, absolutely.
Well, and Nancy, it's been really good kind of diving through so many aspects of leadership from your perspective. And I've really thought about, and I view kind of the whole thing a little bit differently after talking with you today. So I really appreciate your time and all that you've done, not only for this discussion, but for all that you've done for education in your program. But we love asking this final question to everyone at the end. Now, this does not have to involve leadership. This can be anything education-wise, and whether that be entry-level or post-professional. And the question is, if you could change one aspect of healthcare education, physical therapy or otherwise, which aspect would you change, and how would you change it?
That's a great question. For me, I would focus on PT education, and I would make it more standardized. I think that part of the way to address the variability of practice is to have more standardization of the product, the students that we're producing, the new PTs that we're producing. So whether that is a more standardized method of assessing student or graduate abilities, the NPTE does intellectual abilities, but not skills. I would love to see us have standardized assessment of both the soft skills and clinical skills prior to graduation. If we were doing that consistently across programs, some standardized way that we were assessing all of those outcomes. Wouldn't mean you'd have to teach the same way, but that students would be assessed so that we would know that there was a consistency of product. So I'd love to see some standardization of outcomes. Now I know working with ACAPT and the education leadership, or I should use the correct terminology here, working with ACAPT and with the partners, which are APTA, ACAPT, and the Academy of Physical Therapy Education. We have had an outcome strategy group come together, and they are looking at some standardized outcome measures for physical therapy education. And I'm very excited about that. I think that's going to be great. It's going to be measuring those, how we measure those outcomes. That's going to be a critical piece, and using a consistency of measurement for those so that we are producing physical therapists who have the same abilities, and deciding what that minimum looks like so that there is more consistency in practice. Now, I know that we can't control practice because of that sort of disconnect between academic PT and clinical practice, but if we could influence it, here we go again with that word, if we could influence clinical practice by assuring that everyone has the same set of skills when they graduate, that to me would be a big step.
Well, absolutely. And I want to credit Bob Rowe. He, I know, has been a big advocate for, of course, kind of trying to bridge that gap and kind of really help establish true partnerships between the academic side and the clinical side, because I completely concur that, it's not a one or the other, it's an and. Because they're both important. Because I've seen some schools put out some awesome people, then you go to work at a certain position and that can have consequences, either positive or negative. And the same is true vice versa. So it certainly is definitely an and not or in this. And there's definitely been a lot of discussion on how's the best way to do that. And we're still trying to figure that out. And I get that. It'll be some time before we know more about that, or how we'll be less wrong. But I'm excited, but I'm encouraged to see that all that initiative and all that work is taking place, of course, to kind of figure out outcomes. I mean, that's probably the biggest thing right now, like you had just mentioned, like how are we measuring this? Are we being consistent with this? How do we know where we're at when we don't have a consistent outcome thing? So I think that's first and foremost the immediate thing that's being worked on, which I completely concur with, and it seems logical to me. So it'll be I'm excited to kind of see what'll happen in the next few years and see some of the big things that'll happen. But Nancy, if someone perhaps wants to, either reach out, maybe ask a follow-up question on anything that was perhaps mentioned today, or where can people reach out should they have a question or want to follow up?
They can reach me through my email address. So that's nancyr@uca.edu. And I'd be happy to answer any questions anybody has.
Well, perfect. And again, thank you so much for coming on today to sit down and chat. It's been a really enlightening discussion. And, I look forward to seeing what you guys do with everything that you guys are involved with, and keep up the great work, Nancy.
Thanks so much, Brandon.
Access to healthcare is one of the largest issues facing both providers and patients, as millions of people worldwide lack timely and affordable access to healthcare. Anywhere Healthcare, a telehealth platform, is a simple, low-cost option for providers and patients that eliminates the barriers to access to all kinds of healthcare. To find out more, check out anywhere.healthcare, which is available in our show notes. And if you use the code HET in all caps when you email to sign up, you'll save 25% off the total cost. Thank you for attending class today, and we hope that you learned something and gained value from the content.
If you'd like to schedule office hours with us, feel free to add us on Twitter @HET Podcast, on Instagram, HET Podcast, on Facebook, the Healthcare Education Transformation Podcast, and the homepage, healthcareeducationtransformationpodcast.com.
And for those of you following along in the syllabus, extra credit can be obtained by liking us, sharing us, and leaving a review.
Let's continue our journey up Mount Educational Success as lifelong learners.